assisted living center or nursing home?
Finding the right care facility for your elderly loved one is one of the most important decisions you can make.
That's right. So joining us is Jodi Thomas with Quail Assisted Living Center. You know, assisted living centers and nursing homes, they're not the same thing,
no.
But people don't always necessarily know what the difference is. What's the difference between the two?
They are absolutely two different animals. You know, 30, 40 years ago, it was only nursing homes. That's what people knew. And nursing homes today, and we now have assisted living, so it's created a different type of thing going on. A lot of people don't know the difference. So in a skilled center or a nursing, you'll hear a lot of people refer to it as a SNF, a skilled nursing facility or a nursing home. In those facilities, they do higher acuity type care. Say somebody falls and fractures a hip, has to go have surgery. They can't go right from the hospital into an assisted living. We're not staffed to do the physical therapy, the rehab, those kind of things. A skilled center would be an appropriate placement. Somebody that may have a wound that needs daily dressing changes, those kind of things. Somebody that needs lifting, that may not be able to bear weight at all. Assisted living staff cannot facilitate. But in a skilled center, it's under the direction, of course, of a medical director, and then you have registered nurses and licensed practical nurses 24 hours a day, 7 days a week. So they have the ability to do a higher acuity care than what we do in assisted living.
So then is a nursing center, as far as the environment, more hospital-like?
Definitely more clinical.
Okay,
definitely.
And assisted living a little bit more home-like?
More home-like, yeah. That has been a big division between the two. And a lot of times in a skilled center, that can be a short-term stay. It's not necessarily a long-term situation. Again, somebody who has fractured a hip may just need to go for 6 weeks of rehab and then maybe can go back home. But then there are some cases after 6 weeks of rehab, you know, it's determined that they can no longer go back home. Maybe they have a staircase to climb. Maybe they can't do that or prepare meals or do things like that anymore, but they're still able to do things but need some assistance. That would be the time to come into an assisted care environment. In assisted care, we offer services. We have care staff that can do assistance with activities of daily living, bathing, dressing, assistance with medications, meal preparation, transportation, social factors. A lot of people want just the socialization. A lot of people are just lonely at home. They don't need skilled services, but they want to be in an atmosphere where they can make friends and do things, and so assisted living can provide that.
What kind of questions should you be asking that elderly loved one, or asking their physician about what kind of care they need? What kind of questions do you need to maybe talk about as a family?
I think you need to find out, you need to be very real for starters. What assistance does your family member need? You know, what is their mental capacity? You know, are they alert and oriented, or is there some confusion there? You know, can your mom or dad effectively give their own medications? Do they remember to take their own medications every day? You know, are you worried that maybe they're going to turn that stove on and not turn it back off again? Are you worried that they're going to start wandering, you know, out the door and onto the street, those kind of things? Or is your family member just lonely? You know, that could be a huge factor for assisted living. Are they just lonely? Do they need some companionship? I'm a huge advocate for the socialization of an assisted living community, because I really think that as much as medications, people need medications, they need socialization as well. So if you're seeing some depression in a family member, look at that. You know, and again, a doctor can be a huge advocate. Sit and talk to the doctor and say, you know, what's your recommendation? And they're pretty good at that too.
You know, sometimes an elderly mother or father begs their children, don't put me in a nursing home, don't ever put me in a nursing home. What bad things can happen, or what bad repercussions can happen if they go into the wrong kind of home to start off with, that they're not really prepared for? Does that make sense?
Well, yeah, I mean, I tell people all the time when they come in to investigate assisted living, one of the first things we do is we do a physical assessment. We're going to meet that person and find out what they need, because the last thing I want to do is move somebody into my environment and then tell them 2 weeks later, I'm sorry, we cannot provide the services that you need a skilled center. That's heartbreaking to somebody. And then vice versa, if you were to place somebody in a nursing home setting that does not have that high acuity level, and they're amongst a group of people who are not in their arena, again, you're going to have some depression there too.
It's all about finding the right fit.
Absolutely, like with everything. You got to ask the questions, take the tours of places. You know, go in and see places, talk to people, be educated.
Okay.
Very good. Jodi, thank you so much for joining us.
Thank you.
Thanks, Jodi.